Good morning, everyone. We're going to wait just one more moment for everyone to join. Give us one more minute. Okay, good morning, everyone. Thank you for joining us for the Healthy Schools Act and Centers for Disease Control and Prevention School Health Profile informational webinar. My name is Akila Allen. I am the point of contact here at OSSE for School Health Profiles. Today's webinar will last for about an hour. If you have questions, please post them in the question board within GoToWebinar, and I will answer them at the end of the webinar. Okay, let's get started. Today, we will discuss the two surveys that will launch on January 15th, the Healthy Schools Act survey and the Centers for Disease Control, CDC survey. We will also review information you'll need to complete the profiles. I'll give you a preview of what the survey looks like in QuickBase so you can familiarize yourself a bit with the application. Next, we'll walk through next steps and some resources that'll be helpful for you through the process. And at the end, I'll answer any questions that you have. So first, we'll start with the Healthy Schools Act. The Healthy Schools Act School Health Profiles was established as a requirement in the Healthy Schools Act of 2010 to ensure schools are in compliance with the act. OSSE collects information regarding a school's health education, health services, nutrition, and environment annually. And we use the profiles to report up to City Council, the mayor, and the Healthy Youth and Schools Commission regarding compliance to the act. The profiles also provide OSSE with data that allows us to evaluate trends across areas like physical education curricula, and enables us to provide better guidance and determine how we can better partner with DC schools. I would like to highlight that this year, only schools that complete HSA school health profiles will be eligible to receive 2018-2019 school year grants. So for an example of an HSA grant would be our School Gardens grant. The Healthy Schools Act profile contains 7 sections listed here. The school profile that gives general information about your school, health services in your school. Section 3 is health education instruction. Section 4, physical education instruction. Section 5, school nutrition and local wellness policy. Then we have distributing information in your school. And finally, Section 7, the environment. We recommend that one person at each school be responsible for disseminating the school health profile form to school staff members like the health teacher, nurse, or food services director, and then collecting the data and submitting it online through the form. Now I'll move to some key questions that we would like to highlight in the survey. So question 18 and 22 for more clarification. Question 18 asks for average minutes of health education per week. If health education at your school is taught in the same course as physical education, keep the health education minutes separate for the purposes of the profile. For question 22, it asks for the average minutes per week of physical education. Be sure not to include recess, before school events, or after school events in that calculation. For question 22A, it is asking for physical activity during physical education classes only. This does not include recess, before school events, or after school clubs or sports. And then the final question, question 23, we'd like to highlight. It asks the same information as the previous question as number 22, but is specifically for grades, not how it's calculated. So to highlight that for you. Again, if you have more specific questions while completing the Healthy Schools Act profiles, we have a contact for you, and we'll say it at the end of the webinar, that will help you and provide more support throughout the process. So now we come to our Centers for Disease Control our Centers for Disease Control School Health Profile. The CDC School Health Profiles are a sample of public and public charter middle and high schools that are chosen through a random selection process to participate as a system of assessing nationwide school health policies and practices. OSSE is gathering data for Washington, D.C. An email was sent yesterday, January 10th, to those schools selected to complete the school health profiles for CDC. CDC profiles will also be completed in QuickBase, and there you'll only have one login, and it's completed through QuickBase. For CDC school health profiles, there are two separate surveys administered. One is for the principal, and the second is for the lead health education teacher. The principal survey will address topics that include, and that are listed here on the slide, school health policies related to tobacco use and prevention, bullying, sexual harassment, nutrition, school-based health services, family engagement and community involvement, and school health coordination. The lead health education teacher survey will address these four topics: health education materials, collaboration within their school, professional development, and professional preparation. To give you an example of what the questions would look like for each survey, I have them listed here. For the principal survey, it would ask a question like, does your school have a designated staff member to whom students can confidentially report student bullying and sexual harassment, including electronic aggression? This question would be answered with a yes or no. For the lead health education teacher, during this school year, have teachers in your school tried to increase student knowledge on each of the following topics in a required course? There would be different options listed, such as alcohol or other drug use prevention, asthma, nutrition and dietary behavior, emotional and mental health. In this instance, you would be able to check all that apply to your school. How to complete the school health profiles. Now I'll show you the QuickBase system. This is where you'll submit your profile data. I will also show you how to locate, edit, and submit your school's profile and where to find assistance if needed. So we're going to take a quick walk to the school health profile survey in QuickBase. So what you see here will be your landing page. And on this site, and this is QuickBase, you will see in green the Healthy Schools Act, that's HSA, School Health Profile. In blue, you'll see the CDC Principal Survey, and in red, you'll see the CDC Lead Health Education Teacher Survey. I'm going to scroll down a bit. All schools will complete the Healthy Schools Act HSA survey in green. If you were selected to be a part of the CDC survey, you will see the blue and the red circles filled. If you were not selected to take part in the CDC survey, instead of seeing blue and red, you'll see gray with a line drawn through it. In addition, if you tried to select the CDC survey and your school was not selected, it will not allow you to access the survey. So once you log in, it will be clear which surveys you should complete. If all circles are filled, then you are completing the HSA and the CDC survey. So now back to the top. So we're going to take a brief walk. We'll use the Healthy Schools Act survey first. So the first bar here, it allows you to log in and actually complete the survey online. This next bar allows you to print the survey and it's in PDF. And so this way you can share it with your school. It's the printable version, exactly what is on the online survey. Then we have frequently asked questions. The next bar, it tells you information and instructions on completing the survey. And then the final one will be the webinar. And this will be posted exactly what you all are taking part in now. You'll see a replay in the webinar piece. So here, let's go ahead and click on Complete HSA Healthy Schools Online Survey. So as I click here, you will see your school listed. In my view, I see all schools. In your view, you'll only see your school listed. And so I'm going to just click on the first school. And here where you see the little pencil, this is how you'll access the survey. And here, this is where the actual survey is. As you can see, there is a drop down. The survey is blank. You can click into it. There are drop down pieces as well. One really important part I would like to highlight is that the survey doesn't save as you go. So once you input information, make sure that you go to the Save and Close here in green and click Save and Close so that it retains your information. And so now I'm going to just transition back to the webinar and give you a little bit more information for the process. So this coming Monday, points of contact from the last year's, that's 2016-17, school health profile will receive an email directly from QuickBase indicating that they have been added as users for the 2018 data collection. If you are not contacted via email by 4 p.m. this coming Monday and need access to the system, please have your principal or head of school contact OSSE's call center at osse.callcenter@dc.gov or 202-719-6500 from 8 a.m. to 5:30 p.m. The online school health profile form must be completed by each school. For example, if your local education agency includes 5 campuses, each campus must complete the school health profile. We recommend that one person at each school be responsible for disseminating that information and then collecting it and submitting it online. All profiles are due on February 15th. As soon as you receive the email from QuickBase, you can log in. If you do not get an email, then call the call center and you will be added. For access to or technical issues, and this piece is really important, you can call our call center. They're available to help you log in with any issues. You will need, if you decide to email, to your name, title, and school. And please specify if you will need access for just your school or for your entire LEA. The one specific piece that we do ask, if we're adding a new user or giving additional access, like so that you can see all the schools for your entire LEA, the principal or head of school will need to send us an email to confirm that we are okay to add you. So I'll just say that again, the principal or your head of school will need to email to be able to add a new user. So for next steps, again, you can download the printable form and it's found in the QuickBase application. This webinar recording will be posted in QuickBase and on the School Health Profile OSSE website as well. After you submit your profile, you will receive a PDF of your responses within 30 days to be put on your website and made available in the main office. You can see the instructions and step-by-step technical guide on the OSSE website. And we encourage you to take a look at the frequently asked questions. And so now I'm going to take a look. Please feel free to type any questions that you may have. And I'll wait for a moment to see if there are any. So the first question says, will this slide presentation be sent to participants? So the slide presentation, in addition to the recording, will be posted in QuickBase and on the website so that you'll be able to revisit it. If you would specifically like the PowerPoint, you can email osse.schoolhealth@dc.gov and I can send it to you directly. Again, that's osse.schoolhealth@dc.gov. The next question is specifically for SEED, and it's who was selected. And so I can actually email you directly with your point of contact and if you were selected for the CDC profile. Okay, so I will follow up. If you want to email directly, I can give you our school health email and that will come directly to me. That's osse.schoolhealth@dc.gov if you just want to confirm, but SEED, I will follow up on that for you. The next question. Oh, actually from SEED, I can see your name, so that's fine. I'll follow up with you. The next question, will we see which surveys we must complete on January 15th? Yes, so on January 15th, the QuickBase invitation that will go out to you. Once you log in on the 15th, you will see on that landing page which surveys you are required to complete. We did send an email yesterday for all of those people who are completing the Centers for Disease Control. If you didn't receive the email or aren't quite sure, on the 15th, it'll be crystal clear on the QuickBase application. But also, if you have a specific question, feel free to email me at osse.schoolhealth@dc.gov, and I can tell you specifically. And happy to do that for you. Okay, next question. Well, where will the webinar be posted again for reference? The webinar will be posted on the OSSE School Health Profile page. You can either literally just drop that into a Google search, it'll pop up for you, or you can just go straight through the OSSE website on the health and wellness section. And it'll also be in the QuickBase application. So once you log into QuickBase, that tab will show you where the webinar will be. It'll take a couple days for us to get it up, but we're going to get it up as soon as possible. Okay, next question. Monday, January 15th is a holiday. Will QuickBase push the access? Nevertheless, and yes, it will. And so the email will still go out even though it's a holiday on Monday, the 15th, on MLK holiday. Okay, the next question. Can I get multiple sign-ins? I am one LEA and need multiple teachers and departments to put in information. So we've given out access to the principal or head of your school. You can request additional access for 1 to 2 people. We do recommend that if you have lots of people who will have input for the survey, that you print it, distribute it out, and have 1 or 2 people actually go in and submit it online. So we recommend that you print it, have everyone complete it, and then 1 or 2 people are able to submit it online. But you can call the help desk or send an email, have your principal send an email to have an additional 1 or 2 people added. Okay, perfect. Feel free to contact me. That sounds good. Let's see if there are any more questions. Okay, that seems to be all the questions here. Thank you all so much for joining. Again, I want to share our contact information. If you have any specific questions, it's osse.schoolhealth@dc.gov, and it's just osse.schoolhealth@dc.gov. Also, if you are a DCPS school and have any specific questions about the survey, you can contact Sophie Murphy and it's sophie.murphy@dc.gov. Or if you are a charter, you can contact Audrey Williams, and her contact information, it's in the emails that we've sent. So feel free to reach out to us. I'm happy to answer any additional questions you may have. I'm checking the email all the time. So thank you so much for your time, and I wish you all the best of luck as you complete the survey. We're here to help. All right, take care. Bye-bye.